Hello and welcome to everyone. We are with the Pediatric Primary Care Program. My name is Imelda Reyes, and I'm currently a Pediatric Primary Care Nurse Practitioner. I've been the director here at Emory for the last 7 years, and I love working with students. I've been in nursing for over 20 years, and I've been working in Peds Primary Care for 12 years. I completed my F&P here at Emory and realized that I didn't like working with adults. I had been a registered nurse in med-surg and loved my patients in that setting, but when I did my pediatric rotation as an F&P student, I fell in love with kids. What I love most about primary care pediatrics is that my patients are walkie-talkies, meaning that they walk into my office, they tell me what's going on, and then they walk right back out. So I love being able to develop long-standing relationships and really focus on providing holistic care to my patients when they're in the office.
Hi, everybody. My name is Jeannie Rodriguez, and I'm the Assistant Director of the PNP Primary Care Program. I work very closely with Dr. Reyes, but also other pediatric faculty at the School of Nursing. I have been here at Emory full-time since 2015, but I've worked as an instructor since 2001, I think. Before that, I was graduated from nursing school and was an RN. I worked at Eggleston Children's Hospital, which is now part of Children's Healthcare of Atlanta, and I worked general pediatrics and worked in event pod there, and then came back to school, got my MSN actually at Emory, and then worked as a pediatric nurse practitioner at several sites around the Atlanta area, and eventually went back to get my PhD at UAB. So my role here at Emory, I'm sort of half and half research and teaching. So my research focuses on secondhand exposure to e-cigarette vapors in children. But I really love teaching. It's a real passion of mine. I teach a lot of your lecture pediatric courses. And I really have just a passion and love for working with parents and their children. I love primary care. One of the things that I really love about it is just that continuity. You can meet a newborn baby shortly after birth with their parent and see them until they're 21, 22, 23 years of age. And you get to really know that family and work through some things with them. You really have to know your stuff. Because it's just you oftentimes that sees that patient. It's not a lot of other people. It's not necessarily the big team that you get on the inpatient side. So you have to know your stuff and know it well. And you see kids that are well, that are acutely ill, that are chronically ill, and everything in between. So I love the challenge. I love the fast pace of it as well. So that's me.
Thank you. So just to go into a little bit more about our specialty, so Peds Primary Care is all about providing care in a primary care setting to newborns through young adult patients. And so typically you can think of it as we practice in private practices that are usually out in town. Many of us work in community clinic settings, and some may be associated with larger healthcare systems, but again, it's a mix depending on where you are regionally. I always like to tell students about the fact that our bread and butter for pediatric primary care is really checking kids and seeing them for their regular health checks to ensure that they're developing and achieving growth and developmental milestones. We also share a lot of information about safety and other issues to ensure that they're continuing to grow on that healthy trajectory. And I really love spending time with families and sharing and answering questions for them in terms of their child's growth and whatever other questions they may have. We as primary care PNPs may find ourselves working in specialty clinics like ortho or endocrinology or asthma clinics, and chronic disease issues that can be handled in an outpatient setting is generally where you might find us. If you're thinking about going from the pre-licensure program to become a registered nurse and then straight into the graduate program, you may be limited from working in higher acuity specialties such as heme-oncology. Some other major differences that we always like to point out is that an F&P is a difference between an F&P and a PNP primary care program, where in the primary care PNP program, you're exclusively focusing on children from newborn to young adult, and you have to know everything about the different age ranges and acute illnesses. If a child develops strep throat or an ear infection to a more acute illness like leukemia, you are the first line of defense. We really focus on preparing you to act independently and work to the full extent of your certification. So for instance, even though you train in Georgia, which is a restrictive state, you may continue on and work as a PNP in Colorado where, for example, they have full scope of practice. We want you to be as prepared as possible to be autonomous. There is a myth that if you choose FNP, you won't be pigeonholed like selecting a specialty like PNP. And as an FNP, I can say you get exposed to a lot of different areas, and you may be a jack of all trades, but you're not a master of any. And having done my FNP first, I can tell you that there's a big difference in having 600 clinical hours exclusively with children versus an FNP program that may give you 90 hours. We have an MSN and a DNP program available for students. Both programs will prepare you to be an excellent advanced practice registered nurse. Nationally, there's a push to have a DNP as entry to practice for advanced practice nursing, but for now, both programs are available. The MSN is 4 full-time semesters or 7 part-time semesters, while the DNP is only available as a full-time 7-semester program. If you're unsure of which is best for you, we are open to discuss your career goals. A frequent question that we often get is, should we work as a registered nurse before starting the MSN or DNP, or will I be negatively affected if I don't have any nursing experience? The truth is we have many years of data showing that our students who complete our programs do very well. Another frequently asked question is, do students get jobs right away? And it really depends on where you're looking. There are some regional areas that are becoming saturated, so you may have to expand your search parameters when you finish. Lastly, where do I complete clinicals? Anywhere that we can find a clinical placement for you. It could be farther than 100 miles from the school, so you absolutely need a car for clinical. You do not complete clinicals as a group. They are completed individually, so please be aware that you do need an automobile. Both Dr. Rodriguez and I love pediatrics, and we hope that you find the right program for you. We look forward to answering any questions or seeing you as a student in our program. Again, for any questions, please contact us. Thank you.
Thanks.